Break the Pain on ABC 27 is brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. You still have a few minutes to email us your questions at questions@abc27.com, or the phone lines will be open until 8 o'clock this evening. We do have time for one last viewer question. Dr. Gallo, here's the question. I was told the pain in my shoulder and arm is a rotator cuff injury. I was given a shot and a booklet and sent on my way. It did not help. Is there some place I can go to figure out what I should do about this?
Yeah, Deb, there's a whole spectrum of injury with the rotator cuff, ranging from simple bursitis to a full-thickness rotator cuff tear. And any orthopedic surgeon should be able to help you with that problem. Okay,
great. Thanks so much. We appreciate that. We thank you for being here answering viewer questions, and we want to thank the specialists for being here this evening. Once again, they will be here until 8 o'clock. The number is 346-3333. And Chuck, we will send it back to you.
Thank you, Deborah. And, you know, Doctor, tonight we've heard from primary care sports medicine physician, orthopedic sports medicine physician, physical therapist, and both these patients were involved in all these different specialties. How does all this come together at Hershey Med Center?
Well, we try to have a team approach. We all have our sort of niches that we help with. So the primary care sports guy, his primary goal is to treat non-operative type bone and joint problems, and also get into other non-orthopedic type things like heart issues, concussions, gait training, things like that. The orthopedic sports medicine guy really wants to do surgery, but that being said, most of the things we treat are not surgical. So we treat most of the bone and joint injuries, and then we all work with the therapist to help the patient get better.
Do you only treat athletes?
No, we treat anyone who has sort of athletic type injuries. So generally the patients we have are under 55, but they have problems that are sports type things like meniscal tears, rotator cuff tears, things like that.
Okay, now we're running short on time right here now, but what's some general tips on staying healthy for someone who plays in sports and somebody likes to get out and exercise?
The biggest problem I see is people trying to get into their activities too quickly. So I tell everyone, if you were going to run a marathon, you don't not train. So why would it be any different for any other sport? If you're going to go out and do a sport, you need to get out and train and gradually increase your activities.
Don't be in a hurry.
Don't be in a hurry.
Thank you, Dr. Lynch. I appreciate you being here tonight. And we also want to thank you, our viewers, for sharing your stories and sending your questions. And if you'd like more information, by the way, and you'd like to schedule an appointment with Penn State Hershey Bone and Joint Institute, call 717-531-5638, or you can visit online at pennstatehershey.org/bone and joint. And don't forget Saturday, April 21st, come out to the Bone and Joint Community Day at Penn State Hershey Medical Group in Cap Hill for a free lecture from 9 to 1. You want to register at 800-243-1455. So lots to do there. Thanks for watching tonight. We wish you all good health.